Hi, everybody, and thank you so much for joining us today for a special edition of Deborah Kobylt Live. We're here to talk about the coronavirus, fact, fiction, and joining us on the phone right now is Dr. Robert Winters out of Santa Monica, California, infectious disease specialist. Thank you so much, doctor, for joining us.
Thank you for the invitation.
Yeah, I appreciate it. Nobody else I would call other than you. Just today, the World Health Organization declared the coronavirus a global pandemic. It's the first time that they've actually done that. Can you describe for us what is a global pandemic and what are the latest numbers here in the United States?
Well, that declaration is not unexpected. People
Right.
were waiting for that to be declared last week or the week before. Basically, a pandemic needs to fit into three different criteria. You need to have a large number of countries involved in a particular illness. You need to have person-to-person transmission, so people that are not working in hospitals are becoming ill by visiting their neighbors, person-to-person community transmission. And then the third feature is it's a very serious, if not deadly, illness. When you meet those three criteria, you now have a pandemic.
Let's talk about the numbers here currently, and they're changing by the hour. What are the numbers currently here in the United States?
Right, and you're right. It may change by the time I give you this number, but
That's
as
right.
of 2 hours ago, it was estimated there up to 125,000 diagnosed cases of coronavirus throughout the world, and in the United States, 1,110 confirmed cases.
And how many deaths of those in the United States?
In the United States, we have 28 deaths, and throughout the world, 4,591 as of at least 2 hours ago.
Now, according to the World Health Organization, these are important numbers. Sad, but if you're over the age of 80, the death rate is 15%. Is that correct?
Right. What the World Health Organization has reported, age over 60 is a risk factor for having worse, more severe disease, and the highest death rate is for people over the age of 80. But that also doesn't include people that have underlying risk factors, so people that have chronic lung disease, diabetes, other types of immunosuppressive illnesses, chronic kidney disease. Those people, even at younger ages, are at greater risk of having severe disease and dying.
Right. And those are people with predisposed conditions, but primarily over the age of 80. And I'm not saying that that is any less or more important. I'm just trying to add perspective to, okay, the elderly population, and it's upon all of us to keep those people safe, right? I mean, they are
Absolutely.
our loved ones. They are people that we worked with, our work with, our family members. So it's upon all of us to keep our elderly population safe. But again, over 15%, primarily coming from that age group. Under the age of 40, it's under 1%, right, as of now for death. Is that correct?
This illness appears to most severely impact our older citizens, absolutely.
Right. Which says a lot. So what can we do? I mean, we already know because it's been drilled into us. Wash your hands. Practice safe social distancing. Don't go in large crowds. So many things have been canceled, right? I mean, you've got, I don't know, Coachella out here, and that's an outdoor festival, but still a lot of people contained in one place. Canceled. So many conferences canceled. I was supposed to fly to Atlanta for a conference, canceled. What should we be doing to practice safe measures other than what we've already been told?
Well, you did a pretty good job describing what people should be doing. I mean, number one, avoid this virus however you can. So, as you said, keeping away from crowds of people, distancing yourself from people, generally 3 feet away from other people. And we like to say stay at least 6 feet away from somebody who may be having a respiratory illness in case they do have the coronavirus. Avoid unnecessary travel. I don't know who would be taking a cruise right now.
Oh, come on.
That might cost you a month of your life in terms of being quarantined after the cruise. Hand washing, very, very important. Using hand sanitizers are also very effective. We know that
Good luck
alcohol
if you
will
could
kill
find
this
them.
virus.
Sorry.
And
Sorry.
and most importantly, clean and disinfect surfaces that people may have used before you use it.
Today I went to go get my hair blown out before my many interviews, and they were actually doing that. They were getting that Lysol wipes and touching the chairs and the counter, and I thought, wow, I actually feel very safe. Thank you very much. But you're right; those little measures, right, can really get rid of what could be on a surface or not. I mean, sometimes I look at it and I think, gosh, I hope they're not spreading it. No.
No, it appears that peroxide and bleach, and then a lot of these common household products made by Clorox and Lysol, they are very effective at killing virus.
Mm-hmm. And hot, right? They said the sun. I read that somewhere. Now, what is the temperature where if you go out into the sun that you're more likely to sort of hold this virus at bay, or at the very least it won't spread, right?
Well, it's not so much temperature. A lot of it has to do with ultraviolet radiation.
Oh.
So being out in the sun, you get exposed to ultraviolet rays, and that tends to be very effective at killing virus as well.
Let's talk about the difference between the coronavirus, a cold, and the flu. This is sent to me today by a colleague of yours, and I know that you have it as well, Dr. Ross, actually. The difference, and it says coronavirus, primarily the cough is dry. Is that correct? And what about, doesn't it go directly into the lungs, and there's not many other symptoms, right? Could you tell me?
Yeah, I would agree partly to that. Most viral lung infections have a dry cough. That's one of the ways we separate bacterial from viral lung infections. Bacterial infections tend to have a much more productive cough. So most viral illnesses, including the coronavirus and influenza, have a dry, non-productive cough. If you were to ask me about the coronavirus, I think the three most common symptoms that have been reviewed out of China include fever, cough, and fatigue. Those are the earliest complaints that people will have if they have coronavirus.
We see what's gone on in Italy, and I read a piece today that I think I actually sent over to you, and it was written by someone there of note who said, you have no idea what you people in the U.S. are in for yet, because about a month ago we stood where you stand, in which case we had just a few hundred, and now look at us. The entire country is on lockdown. What, in your opinion, are we headed for?
Right. Well, I don't know who wrote that, and I really don't know what their credentials are. I think that might be overly dramatic.
Okay, fair.
I think that we are going to have a very significant proportion of our population become infected. America is estimated to have a population now of about 329 million people, and it's estimated conservatively that 10% of the population, and that's a very conservative estimate because I've seen numbers go up to 50% of the population will likely be infected by this coronavirus. So you can do the math, and a lot of it becomes quite worrisome if you assume just a 10% infection rate of the general population. We're talking about 33 million people infected by this virus.
That's a huge number, though, because basically, aren't they saying pretty much 2 to 3% from the World Health Organization, 2 to 3%? Could become infected? I mean, 10 is pretty high, no?
No, that's actually a conservative figure.
Is that right?
You know,
okay.
when we look back at the swine flu back in 2009, remember the H1N1 coming out of Mexico?
Mm-hmm.
There were over 60 million people infected in the United States. 60 million people. And what the mortality rate was? 0.2%. 0.2%. So these are huge numbers. It's a very contagious virus. But I have bad news for you and your listeners, and the reality is coronavirus is more contagious. It is more transmissible than influenza virus. So the math becomes a little bit worrisome, and though I don't raise the alarm as the writer did from Italy, I think the numbers do become a little more concerning when you start thinking 33 million people being infected by this virus. But you have to remember, at least 80% of people that are infected have mild illness, and they don't necessarily need medical attention, especially younger people, people that are healthy without underlying medical conditions. They may stay home from work for a few days. They may stay home and never go see their doctor or never present at an urgent care clinic or an emergency room. So don't forget, 80% of the people that become infected may not have a serious illness. If we think worst-case scenario, say 1% of the people tend to have a very, very severe illness, and that would probably be our elderly population and those with underlying medical conditions. Well, 1% of 33 million is still 330,000 people.
Right.
And what we
Sorry, and you were mentioning that in terms of ICU beds around the United States, we have about 120,000 ICU beds, and half of those are even taken up with sick people with heart problems and strokes and other injuries. So if you've got just 1% of the population infected with 330,000, that's a loss of, I don't know, 200,000 plus beds. So what do we do? If that's
Well,
possible,
what we have to do is draw this infection over a longer period of time so we can manage people. And I think the analogy that I've given previously is if you are a fireman in a fire station and you have to put out 50 house fires, well, would you like to put out 50 house fires over 50 days, or do you want to put out 50 house fires in one day? If you do it over 50 days, you'll probably save every single house. If you have to put out 50 fires in one day, I suspect 48, 49 houses will burn to the ground. So the point of the matter is we're going to try to draw out the number of people that are ill, and instead of them all presenting in the month of March, April, and May, with good personal hygiene and all the other measures we talked about, staying away from infected people and staying away from crowds, maybe we can draw this out over a 6 to 12-month period. But I think it's already baked in, Deborah. The reality is I think we're in for millions of people being infected with coronavirus.
Wow.
And that's already been already supported by Dr. Anthony Fauci, the very respected infectious disease doctor through the National Institute of Allergy and Infectious Disease. He's already been telling people that we may have to instill some of the precautions that Italy and China have taken in terms of quarantine large areas and groups of people. So he's already sort of presaging what is probably going to happen.
All right, so what's next? In our own community here in Southern California, there have been, because our show is seen everywhere, honestly, there have been, that's grown as well. How many cases in LA County? Just a day ago, I think there was one. So that's grown, right? And Orange County, that's also grown. We have people here in local hospitals now, am I correct, with the coronavirus?
From what I've been told, we do. I don't think too many areas are going to be immune to this, other than Antarctica.
Right. Well, there's a place to go on vacation, I have to tell you. If you're really looking for a place to go to Antarctica, where very little is living in the first place. I mean, so there you go. People
no cases reported yet in Antarctica.
Right. So and there's some states too where it's not reported. Am I correct?
But I think it's a function of time.
Do you?
From what last I heard, I believe there were 38 states that have reported some cases of coronavirus.
What makes this one worse than almost anything else? Is it because of the way it affects the lungs?
Well, I think it starts with it's highly, highly contagious.
Right.
It is highly, highly contagious. And then the fact that people can spread this virus before they become symptomatic, that's very unusual and potentially alarming to most treating physicians. Can you imagine you're able to spread this illness before yourself have any symptoms of it? So how can you worry about somebody infecting somebody when you yourself don't have any symptoms?
My husband has a little bit of a cold, and he was coughing, and I kicked him out into the next room, and he's like, I'm fine. I said, I don't know if you're fine. Get out. So, I mean, even I'm actually heeding the advice of the authorities. I got a little bit nervous. He goes, Deborah, this is a cold. I said, well, just in case. So
I know, but the problem is we're also in cold and flu season.
Right.
So, there's things called adenovirus, there's rhinovirus, there's influenza A, influenza B, respiratory syncytial virus. This is cold and flu season, and it's very, very common to have a respiratory illness. So not every cough, not every sneeze is necessarily coronavirus. On the other hand, we know it's out there, and there are estimates that thousands of people are already infected. They have just yet to either be diagnosed or they've not yet been presented to doctors and hospitals.
Yeah. So, what is next? I mean, just heed the advice of the professionals, and then, I don't know, we just have to brace ourselves, right? I mean, we all know that we're not supposed to be going into crowds. Let's say, okay, I'm going to, personally, right? I am supposed to be attending a small gathering, but it's, I think, of a couple of hundred people tomorrow afternoon for a luncheon. Should I go or should I stay home? Actually,
I'd
tomorrow.
skip it.
What?
I honestly, I think for the next 2 to 4 weeks to see which way this really plays out, I would avoid all unnecessary crowds of people, groups of people, more than 5 or 10.
Hmm.
I think that we don't know exactly how this is going to play out. And if we end up in a situation like Italy or China, I think you'll be very happy you took that advice.
Yeah. All right, doctor. Any parting words? And I appreciate you coming on. Maybe we'll check back with you next week as well.
Yeah.
Any parting words? Because I know it's going to be a very different equation next week that you
Yeah.
can tell to our listeners and viewers.
Well, look, I would take it in stride. We've had a number of epidemics and pandemics in this country, and America as a country has survived. And I know there's been individual, cases of death and sadness, but as a country, we will get through it.
We'll
I
get
think
through
we
it.
need to make an effort to avoid overwhelming healthcare facilities, whether that's doctors' offices, urgent care clinics, emergency rooms, hospitals. Try to avoid burdening those places with, non-critical, non-urgent types of illnesses, because I think the coronavirus may start becoming more of an impact on these places. And what's going to happen is you're going to be waiting there for hours to be seen because you sprained your ankle. So everybody should try to, as best they can, take it easy especially the next 2 weeks, and try to avoid your doctor's office and other places.
Before I let you go, are there enough test kits out there? I mean, I was reading today that somebody went into a hospital and they were sent away, and in fact, they were very sick. And I don't know what his story was. If there were no test kits, or if they just didn't think he was sick enough. What's the story?
Well, to my knowledge, that has been a thing of the past and a real problem, even as recently as last week. To my knowledge, there are more than 1 million test kits available throughout the United States. Private laboratories now are involved in testing. Previously, it was only a federal government type of, health department, state or federal could only do the test. So now it's been contracted out to private laboratories as well, and that will continue to ramp up. So I think testing has been a problem. I think we're getting on board to realize that we don't have enough capacity to test everybody. So that's changing, and I do hope over the next week or two, whoever needs a test will be able to get one.
All right, Dr. Robert Winters, infectious disease specialist here out of Southern California. We really appreciate your coming on our show. We appreciate it very much.
Sure, my pleasure.
And sort of sorting through fact from fiction. So thank you very much. And thank you, everybody, for being here for a special edition of Deborah Kobylt Live. If you want to reach Dr. Winters, I believe, right, Doctor, that they can ask questions through, what, your social page?
Yeah, or through my travel clinic, the Westside Travel Medicine at gmail.com.
Perfect. Again, thank you, and thank you, everybody, for being with us today. I mean, it's a concern for everybody, so we just felt a need to do a show on it and update everybody on the latest of what we know. So thank you again for being here for Deborah Kobylt Live. You can watch our show Facebook, YouTube, and listen on the iHeartRadio app, Apple Podcasts, Spotify, and just about anywhere else that you get your podcasts. Thank you for being here. We'll see you next time. Bye-bye.